I'll call this meeting to order. We'll start with the consent agenda. All the following items which concern the items of routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the monthly finance meeting on January 19th, 2016. Minutes of the monthly trustee meeting on January 19th, 2016. And a check report January 8th, 2016 through February 7th, 2016. One of you.
I move the approval of the consent agenda.
Second.
Nobody passed out our small cards. What is
I know. I have a motion from Dr. Brown, a second from Terry Klein to approve the consent agenda as it is presented. Roll call vote, please.
Hang on. I think Jason's doing that.
Kim Brown?
Yes.
Klein?
Yes.
Gaspard?
Yes.
Kinsey is not here. Simon?
Yes.
All right. Next is the CEO's report. Candace?
All right. Well, as you notice, somebody is sitting in the chair. This is Drew. He's learning as we go. He didn't have any training, so he's getting just-in-time training. So we're getting there. It's been a busy week. He's doing good. All right. So not a lot on my report. I don't know. I can't remember if I brought this up last month, but we did successfully complete a testation for the EHR project in January. And that payment is expected roughly in about a month.
Right, probably in March.
The next quarterly upgrade goes March 3rd, and we went live in the physician clinics with eClinicals, so the physicians are on software in the clinics and getting used to that. It is a challenge. It does slow your pace down and can't quite get through it as quickly, but they're doing well. They're getting the hang of it. Marketing continues. Homestead's advertising in the newsgram, Facebook, and on the electronic billboards. Upfront collections for January was down just a little bit, $27,183. Nursing staff attended an EKG and capnography education provided by Northwest Technology February 26th and 27th. And I have to say, I have not had a group of people so excited about a training as this group was about that training. They were they not?
Oh, yeah.
Super excited, talked about it for days, learned a ton of great information. So thank you for letting them do that. Dr. Gulliford provided nebulizer therapy competencies for the February training. We have two Northwestern students currently doing their capstones with us. One is in the ER, one is on the floor. Speaking of the acute care, we have 7 patients right now, so that's pretty exciting. It's been a while since we've had 7 patients on the floor. And Dr. Kinsey and I, back a couple of weeks ago, attended SSN's retreat in Del Mar, California. It was a great experience, and we're actually going to take that a little bit further on Friday and talk about some more opportunities. Bridget's coming back up on Friday with Kyle and Chuck, and we'll do some more planning. Other than that, there was a great, Lynn pointed out in the paper, under the Kiwanis, Lynn?
Yeah.
That a patient had been seen in our emergency room and was given a clot buster for stroke symptoms, got to Oklahoma City, and they said that to give Share Medical Center a big pat on the back because the patient didn't have any residual effects from the stroke because of the drug that she received in a timely manner. So shout out to our ER staff for that, and that's why we're here. That's why we do what we do. Alrighty. Is there anything else? Can't think of anything. You guys have any questions for me?
Anybody have anything for Candace? If not, Candace, thank you. And I would entertain a motion to accept her written report.
Mr. Chairman, motion to approve the Share Medical Center written report for February 16, 2016.
Second.
We have a motion by Terry Klein, second by Hala Simon, to accept the Share Medical Center written report for February 16, 2016. Roll call vote, please.
Klein,
Yes.
Casper,
Yes.
Simon,
Yes.
Brown.
Yes.
All right. Next is CFO's report. Kevin?
Okay. For the month of January, the revenues for all three facilities were almost identical. We posted $1,626,344. Like I said, it's down $2,630. The hospital's revenue for the month decreased by $33,260, but the nursing home made up for that by increasing their revenue by $32,894, and the Homestead was almost identical at $2261. Total patient days for the hospital were 71 in January compared to 38 in December. Hospice days were 69 in January compared to 96 in December. Our clinic visits for January were down. From December, we had 1107 in January compared to 1272 in December. But our nursing home average daily census increased by one patient per day went up to 53 compared to 52 the month before. Contractuals for the month were 49.1% of gross patient revenue. Accounts written off to collection agencies was $91,023. We did give away $5,912 in charity care. And our operating expenses, excluding salaries and benefits, totaled $426,540. Salaries and wages actually seeing a decrease of $29,918 compared to the prior month of $511,998. We had a net operating loss for January of $228,593. But after sales tax, contributions, and everything else that we could add back on, net loss for January is $116,897. We had $153,685 of cash on hand at the end of the month, which represents 4.6 days. Our accounts receivable increased by $177,461. Days went from 60.1 up to 67.1, and net days went from 46.9 up to 51.2. Our days in accounts payable represents 58 days, or $718,027. Kind of looking over each of the different pages. Like I said, overall we were at $116,897 loss compared to last month we lost $230,000. So we did see some improvement from month to month as far as that goes. The other line item that you'll notice was up quite a bit was the other expenses, but this is the month that we have to pay the shop payment, which is $65,000. So the other expenses went from $177 to $241. Almost all that's attributed to the shop payment as far as that goes. Comparative side by side, you can see for all three facilities on page 4, we're up about $230,000 gross revenue. Our net revenue was, even though the $200,000 increase, we only were up about $22,000 net. Last year at this time, we lost $565,000 from all operations. This year at $1,572,000. And last year, our net income was a positive $405,855 compared to a loss this year of $854,56. But remember, we had sales tax last year of almost $800,000. So if you take that into consideration, we're still about $400,000 difference from true operations itself. So the next page is the hospital's income statement. Like I said, we were down about $30,000. We did see a little bit of improvement in our net operating loss. We only lost $254,000 compared to $300,000 the month before. Even with sales tax, $143,825. Next page is the year-to-date side-by-side. Follows the same logic. Last year we had a $570,000 net profit. This year is $784,000. But if you take out about the $800,000, you can see we're about the same, about $400,000 less than we were last year at the same time. The nursing home this month, with the increase in revenue and everything, instead of having a loss this month, they actually made $4,117. So that was a positive. So they lost $34,000 the month before. So that's a really good thing. So that's a good job. You did a good job, Rita, on that. Year to date, this year we're at $165,488 loss in the nursing home compared to $225,000 last year at this time. The next page is the Homestead. Revenue continued about the same. Expenses were down. We actually made $22,811, so that's by far the best month we've had in the last 6 months as far as net income, so they helped contribute to the bottom line. Pages 11 and 12 are accounts receivable. Page 13 and 14 is our balance sheet. And the last few pages is our graphs of all the different statistics that we keep track of as far as patient days, ER visits, OR procedures and stuff. Have any questions for me?
How much is your meaningful use money gonna be?
It should be a little over $500,000 when we get that attestation for that. Plus, here shortly on our cost report from last year, you should see over $400,000 for that because our Medicare mix actually went up and our days went up, so the government shorted us by that much. So we should be seeing that here also as well.
Okay.
So should have 2 checks from Medicare for meaningful use.
Okay.
Does anybody have any questions for Kevin?
Hey Kevin, do you think the emergency room visits, do you think that's kind of plateauing now? Like
I
we're kind of
think-
reaching equilibrium with the urgent care, got some experience with it now.
Yeah, I think so. I think where it's going to be from now on, because after urgent care opened up, that's kind of where it dropped off to, and we haven't really seen much fluctuation. Maybe 10 or 15 visits each month from one month to the next. So overall, so
Yeah, it's right around that area.
Yeah.
Keeps plugging along.
yeah.
Certainly, we were hitting our target way higher than a number of patients per day with urgent care.
Right. Yeah, they're doing.
Plus, one thing that I keep hearing over and over is, the younger generation doesn't care about establishing with the primary care. They want to be seen when they want to be seen. It's more about the convenience than the money. Those are the 2 things that you hear. So I think the urgent care serves a need, definitely.
Yeah, the expanded operating hours seem to be a plus too,
Mm-hmm.
knowing that it's available after normal hours.
Right.
Do we know how many people are coming after hours as compared to normal?
I don't have that right off, but I could find that out.
Just curiosity.
Yeah.
The people working at the desk up front will say that early morning and then after 3 o'clock is the heavy times.
Early morning, they want to get there.
Yeah. And then after school's up, it starts. And almost every night, there's somebody there that walks in their door
8 o'clock.
8 o'clock.
8 o'clock.
Right.
7:58.
Yeah.
I understand. I mean, we better go before they close.
Yeah.
No.
Mhm.
Okay. Any other questions? All right. Kevin, thank you. Next
Not
is the
here.
Medical Staff Executive Committee.
What happened?
She's just caught in clinic. She knew that she said, I'll be there.
Okay.
obviously.
Um,
running behind.
is there-
Let me look over it.
There's two appointments
Yeah, they-
for the credentialing.
They approved them in medical staff, but I don't know if she needs to make the motion or not.
She doesn't have
She
to
doesn't
make
have
it,
to.
she just
Okay.
usually does, because she was at the meeting. So, how about we do this? Let's move over to there's no new business, there was no old business, just as you read through their agenda. Well, did I miss? Hold on a second. Oh, down here. So they made a motion to approve both Dr. Smith. Who made the motion, Dr. Kinsey seconded it, to approve both of those folks. So, if somebody would like to, entertain a motion that we could, appoint courtesy staff, and we can do both of these, Rick, in one.
Really have to have a second.
Do them separate, okay, very good.
I would make a motion that we appoint courtesy staff, Dr. Nathaniel Ott, MD.
Okay.
Second.
We have a motion by Dr. Brown and a second by Terry Klein to appoint courtesy staff Nathaniel Ott, MD. Roll call vote, please.
Gaspard,
Yes.
Simon,
Yes.
Brown,
Yes.
Klein.
Yes. Motion to appoint to courtesy staff David Bishop, MD.
Second.
We have a motion by Terry Klein, a second by Kayla Simon to appoint courtesy staff David Bishop, MD. Roll call vote, please.
Simon,
Yes.
Brown,
Yes.
Klein,
Yes.
and Gaspard.
Yes. Okay, thank you.
We need just to make one correction to those minutes. On the CEO report for the January 14th notes, we had not been to the retreat yet. That's February notes.
And this is on what?
This is on the January note, where that's dated, yeah.
Okay, that would have been back up under the, this
That
month?
needs to come off. Because we hadn't been to the end of
I think
February.
it should be.
I think the dates.
I think the date.
Oh, this is wrong?
The date up there's wrong.
Is that what's wrong?
Because we met,
Yes.
just this month on last, which was last Wednesday.
Okay, yeah, that's right.
Okay.
The agenda was for the February meeting.
As I say, the medical staff, medical staff executive, their agenda meeting actually says February 11th.
Yeah, that's the date.
Okay, all right.
Gotcha.
All right, next item. Coffee, is there anything?
Yeah.
Nothing for coffee?
Mhm.
Okay, we will move on then. Is there anything for improvement to patient care?
There is the contract that's actually underneath medical staff. It's the validation,
Yeah.
calendar. So,
Okay, some of these are scratched out.
right, because they were not completed, so I didn't want you to approve those that we need to work
Okay,
on.
okay. Does anybody have any questions about that? It doesn't necessarily take a vote for us. If not, these ones that were incomplete, I guess they will come next month.
Yeah, they should.
Okay. All right, very good. Next is the Share Convalescent Home Report.
Okay, Christy and I will be attending the Leading Age Annual Conference in March. We had in-services from the Northwest Technology Center this month and HIPAA, which was very informative to the staff. There is I have gotten some information from Leading Age about some problems in nursing homes with a little bit crossing the line with resident pictures, photos, cell phone, Snapchat type things. So we went over those also, just to let them know how important it is not to cross that HIPAA line. And Alan was there to inform us also that that line is very thin. So I think all the staff understand that. We had our candlelight dinner, a night in Paris. I know I said gay Curry last time, but it's the night in Paris. We had an archway and we had all of our residents go under that and take pictures, and we'll make copies of those and send those to their families. And they were very appreciative. And the meal was good, the music was good, and we went home full. Let's see. The nursing department is trying to stay within their allotted hours. The dietary department is actually looking for a part-time staff person. Housekeeping is minus an employee. I'm not sure that we'll look at filling that. I think we're doing okay without. The fire extinguisher system in the kitchen has been, I don't know, revived, I guess. They go in and they make sure it's working appropriately, and they have to do a 5-year test on it. So they did that this year. And I think that's it. We do have less skilled patients for the month of February. We had 3 of our skilled people have returned home or back to Homestead. Our skilled days, I think, were 133, which would have been about 30 down from last month or December. We only have 1 skilled resident right now. We will have a new skilled tomorrow. Our census is down. We lost quite a few of our skilled, so we'll be looking to try to fill those. I'm actually looking to see if I can't relocate or jumble the patients for better efficiency. We'll look at it. We'll see. Other than that, any questions?
Well, thank you. Thank you for your efforts and working with your folks on the hours as well. That's great. Next, he's still at Kelly. Did somebody leave? Sorry, I thought I heard
He
somebody.
got up a while ago.
Maybe that's what it was. Okay, the Homestead Report. Somebody left the room. I know I saw somebody walk
I
out.
did leave earlier.
Okay,
But yeah.
maybe that's what it was. I wouldn't imagine things.
Oh, I should have just thinking down.
January was a good month for the homestead. Again, we had, I think it was our 2nd month in a row where we had people move in, but nobody moved out. That's going to be the case again in February, I believe, at this point. We do have some move out scheduled for March, though. We're at 87 just over 87% occupied, which is pretty full. And so the staff are all working hard, and it's 13% better than last year in January. Had a busy month of activities as well. We started working with the Oklahoma Healthy Aging Initiative. It's through the University of Oklahoma Health Sciences Center, but they have been bringing out kind of some health awareness type activities to our residents. Part of our, what we need to be striving to do is to make sure that our seniors, as they age, they're able to do so healthily. So they've brought some really good activities to the homestead, and probably the one that's getting the most attention right now is Tai Chi, and the residents love it. They're packing the room every time they come to do the Tai Chi exercises, and it's been proven over and over again in different studies that it's good for core strength and balance, and just general strength and conditioning for senior populations, and it's a no impact program the way we do it. So that's been good. We've had some college students out to do some activities with the residents. They had a board game afternoon on a Sunday, and that's a pleasant add because generally there's not anything going on Sunday afternoon, so the residents enjoyed that. And had one day of significant inconvenience on January 14th. There was a water line break in town that we thought was causing a water outage at the homestead. Come to find out that it was a separate event that had nothing to do with the reason why we didn't have water, and our water softener had actually gone bad and clogged up the line, so the water was coming into the building but not going anywhere once it got to the building. So water was restored to the community, and we still didn't have water, and we were perplexed. But we had all taken care of now. We had water restored that day by bypassing the water softener, but the water softener at this point has been replaced as well. And will be probably by the next time the hospital authority meets, the city will probably install a new hot water heater system. A few years ago, before I became the director, they'd had one of the 3 hot water tanks go down. Capacity was still fine though to run the facility off of 2 hot water heaters, and the second one is nearing the end of its useful life. So we're going to hopefully have that taken care of by the next time we meet. Other than that, I'll answer any questions.
Any questions for Kelly? If not, Kelly, thank you. Do you have a SMC Foundation report?
Foundation board didn't meet in February, but we have sent out the scholarship applications to the guidance counselors for our Alva Hospital Authority scholarship. So we sent to, we're trying to send to Winoka Freedom, Cherokee, South Barber, Alva. I think I said them all, I don't know. But 2 of the schools were closed on President's Day, so I didn't get around to getting that to them today. But we'll get those scholarship applications out for a deadline in March of submission, and then our board will we'll host our volunteer donor appreciation dinner the 2nd Thursday in April. And then we'll also vote on the scholarship recipient at that time.
Okay. All right, Kelly, thank you. Next, Bridget, St. Anthony's report.
Okay. I brought some SSN Policy Advocacy updates for anybody that would like some light reading. It is a nice little document that they put together. I think everybody's aware that this year is certainly a contentious year for healthcare, and so we're following advocacy very strongly within SSN and then within St. Anthony's here in Oklahoma as well. Just so you're aware, we do get a regular advocacy update from Jimmy Durant, who's part of SSN, that office is there locally at St. Anthony's, so he's good to send out regular reports about what's going on at the OHA level and at Oklahoma Healthcare Authority, and just in general what's going on in Oklahoma from an advocacy standpoint. I think, did he have the opportunity to come to your community and
He
visit?
came to Eggs and Issues,
Good.
was it last April, maybe?
Can't remember. Time flies when you're having fun. I couldn't remember when it was, but he is available at any time if you have any advocacy things that you're trying to communicate in your community as well. If you need his assistance, he's more than happy to come down and help with that as well. We also get advocacy updates from Premier, who's also our GPO. They're good to send at a federal level the updates as well. So this is kind of a summary of kind of SSN and their history of it, and then the advocacy that's currently going on. The other thing is, like Candace mentioned at the medical staff retreat, I think there were some good takeaways from that meeting. So we'll visit in deeper conversation on Friday, and kind of in conjunction with your strategic planning retreat that we had last month, to kind of see what our goals are, that we can help make sure that we're focusing in the right direction for y'all in this upcoming year. I think since the last time that we met at the planning retreat, I think most of y'all are aware that, that Sayre closed their doors. So they were a PPS hospital as well, had a brand new facility, and unfortunately had to close their doors. So I think there's a lot of angst in Oklahoma right now surrounding healthcare. So we as SSN St. Anthony, we want to be sure that we're putting our focus in the direction that the rural hospitals need. So we'll spend a lot of time visiting about that, about kind of what your goals are for us in this year. So if there's things that you know that we need to be working on, then please make sure that you let us know as we're moving forward, because we understand that the PPS hospitals are the ones that are most at risk, unfortunately. Just because it's volume related. It's a payment system that was built under volume, and we don't have cost reimbursement like prophylaxis hospitals to fall back on. So if you don't have volume, you have to make it up somewhere, and we're bridging that gap between a pay for multiple performance, a fee for service, every visit, every procedure type of a deal, moving into a wellness environment. And so all the hospitals are experiencing less inpatient admissions, and those are going to become less the more that they push for us to move into wellness. So we have to be sure that we're ready on the outpatient side and to make up for some of that volume and dollars that we're used to coming in on the inpatient side. So we certainly want to be focused in the right direction this year on what we need. March 11th, we're going to have the patient experience training, and Candace was nice enough to host that. Some of the other Northwest Oklahoma hospitals will come here, and we'll do some of the training for patient experience, and that's directly related to your HCAHPS report to get the best performance and best measures out of your HCAHPS report, because that is directly tied to reimbursement. So you want to be sure that you're performing well on your surveys from your patient's experience. So we'll be doing some training on that later next month. We do have our Premier GPO quarterly meeting coming up. Once a quarter, we add that on to the backside of our affiliate meeting. This month, we'll be inviting the materials managers. I'll be sending out a note to that tomorrow. And then we go over some of the current topics that are happening in your group purchasing agreement, just to be sure that you're maximizing. You haven't got your official report back, but I visited with our representatives in Premier, because we had them look to be sure that that you're getting your full optimization off of your group purchasing organization. And at first blush, it looks like y'all are doing an amazing job. So there's not a lot of opportunities for cost savings in that, because you're buying your contracted items, and you're staying with your formulary, so you're doing a nice job with staying with your contracting, so you're optimizing on your costs in those areas. But those are things that they continuously look at, and they have several different services that you can submit, and Kevin's been great to submit some information, gives you lots of information back, so you can continue to kind of look at that whole cycle of your business. So it's always appreciated when they participate in those tools that are out there ready for your use. But at that meeting, like I said, we use whatever topics that the affiliates feel like they need some updating on, and we just take them the most recent relevant things that are going on, whether it's contracting or whatever the topic be. So I think in most part, unless I've left something out, Candace, that you'd like for me to share, I think those are kind of the things that are coming up in the next 30, 60 days. There she is. Better late than never.
So I'd be here.
You jerk.
You squeaked in on that one.
Does anybody have any questions for Bridget?
Wow.
Bridget,
Already to
How time flies.
is there any place that we can go to see kind of how different hospital progression or regression, I guess, are the ones that have dropped off? Is there
Can we go find that?
And actually, we put a report together that they presented at the medical staff retreat, just so that you could kind of get a feel of how the other hospitals in our affiliate network are performing. I mean, unfortunately, everybody's in the same kind of boat that shares medical's in right now. We put comparative data, I think, for 14 and 15, and then what you have period to date for 16, so you can take a look at that from a financial standpoint. Now, statistically, we didn't put any of that together, but very easily can. Absolutely can. You know, if you're wanting to look at that, we absolutely can do that. We just thought it was important to kind of, you know, trend out kind of where we were in 14, where we were in 15, and then where we're at in 16. Yeah. Because we do have concern, and we want to try to help as much as we possibly can to stop that bleed, because we understand we're all in that middle spot where there's less volume and no reimbursement to help make up for the fact that there's less volume. And like I said, it's critical in the PPS environment right now about how you attack that and stay in front of it. So.
I have a question, a comment that fits in here, I think. You were talking about the patient satisfaction surveys. Currently, we're doing that by phone calls, done by a volunteer. And that volunteer would welcome any other volunteers. Because you know, the older folks I can get a hold of daytime pretty easy. The parents of young children, generally somebody's at home. But the working folks, I'm not going to be able to get when I'm calling between 10 and 11 o'clock in the morning. So we're going to have to look for somehow to get those calls later in the day. And it's not this volunteer that's going to make them. But if anybody knows somebody that's looking for something to do, it's a simple job. There's nothing to it. You just got to chat with the people on the phone and ask them a series of questions and how they like their service. And I've been at it for a little over a week, and I've not yet had anybody slam the phone down at me. So it's going well.
I might mention that when I interviewed Johnny Jones, he said that he plans to come out here and volunteer. So you might approach him.
He was one of them I had in mind.
He can do the nighttime calling.
Yeah.
All right, are there any other questions for Bridget? If not, Bridget, thank you very much. Bo's not here, so we don't have a city council report. I don't necessarily have a report. I will say something though in regards to volunteer work. And Dr. Brown, I don't want to embarrass you, but and I know he's been rewarded before for his time and efforts, but this guy does a lot from not just up here and answering the phone or whatnot, but this guy does a lot, and I don't know how many employed people we would have to take care of all the things that he does, but he gets in there, he gets involved, and he does anything and everything, and thank you.
Appreciate it.
And for your time and your efforts and dedication.
If I wasn't on fun at it, I wouldn't do it.
Well, yeah, and I know the employees appreciate you as well.
And that's one of the real pluses that I felt about it is that they are very, very open in letting me know that I'm helping them out, and that's good.
Yeah. Well, thank you for your efforts. We do not have any other items, new business that have come up, so we are adjourned.
Yay, you.